And welcome back to Talk of Alabama. Joining us now is Dr. Lyle Cain, Jr. with Andrews Sports Medicine and Orthopaedic Center right here in Birmingham. Now, he specializes in treatment of sports-related injuries and is recognized as one of Major League Baseball's 10 super surgeons. Welcome to you, Doctor.
Thank you, Nicole.
Well, I'm glad you're here. This is a topic that so many parents out there have thought about and have talked about. And it seems in recent years that elbow injuries in this sport have become quite the epidemic.
No question. We're definitely in the middle of an epidemic right now. And it's interesting if you look at the Major League data. I think it's become much more mainstream media now because of all the Major League Baseball players that have been injured in the last few years. But it happens a lot at the youth levels also. And we see 15 to 20 athletes per week in our office that are young athletes, that are throwers, baseball players with elbow injuries. So it's a very common issue. And we think it's due to kind of over-specialization. We see kids as young as 9 or 10 that are treated like professional athletes. They play year-round. Yeah. They have training throughout the off-season. They have pitching coaches. They never really have time off, and we think that's really the genesis of a lot of these problems.
So overuse and over practice in many cases.
Exactly. So it's just a matter of not having enough rest for the arm.
And then are there any other injuries that you guys are seeing a lot of besides the elbows?
Well, the shoulder is a common problem also in baseball. Yeah. And again, an overuse problem. Very similar reasoning and very similar background. The young arm is not made to throw overhand, and so the more you do it, repetition, you cause stress on the bones and the growth plates, and it causes injuries. No matter how mature you are or how you throw, yeah. It's really a problem.
And there's really right now a national campaign going on that's aimed to educate parents and players, right?
There is. Major League Baseball has really stepped up. That they see that this is becoming a problem, and I think from a financial standpoint, it's a big problem for the league. Yeah. And what they did is they used our research that we put together at ASMI, which is the American Sports Medicine Institute here in Birmingham. And from that research information, they developed a website called PitchSmart. Mm-hmm. So you can go to pitchsmart.org, and at that website, it actually has pitch counts and recommendations to try to keep your kids from getting hurt playing baseball.
And there are some set guidelines, right, that can really, I guess, help us prevent injuries.
There are. We know from the data that we've compiled over the last 15 years that there are certain crucial landmarks that you don't want to cross in terms of number of pitches, number of innings, certain things as playing for two teams at the same time, doing a lot of what we call showcases, yeah. Playing pitcher and catcher in the same game. There are things that we think you need to avoid that are kind of the ultimate no-nos for baseball that'll lead to injuries more frequently than not.
It's interesting. My kids are only 2 and 5, so they don't play anything yet. They have no interest in it. I've actually encouraged them to try to get into it, but they just want to play in the dirt right now.
That's great.
But you've got kids that are older that play baseball, and so are you very conscious about when they're out there playing and what they're doing?
I am. It's really interesting. My sons are 14 and 11 now, so I've seen the progression from T-ball through Little League Baseball, yeah. On into junior high baseball now, and you know, it's interesting to see the progression from a parent standpoint. Yeah. In that some kids are really gung-ho about it and they want to play every day and they want to really get after it. Some kids, I think the parents are pushing them to play. And so as a parent, I think we have to, you know, not push the kids too much, allow them to play in the dirt and to play in the yard and to play in the neighborhood, yeah. and not do organized sports all the time. And I think that's a problem we have right now is that, you know, parents see this as being an arms race, yeah. Where you have to be training, you have to be coaching, you have to be constantly treating the kid as if he's a professional athlete. And I think that's a big reason why we're seeing these injuries.
Yeah, and we all know that annoying dad at the ballpark who's, you know, screaming at his child like he's, you know, a professional player or something. Anyway, thank you so much for being here. How do people get more information?
Well, they can go to our website, which is the Andrews Sports Medicine website, andrewscenters.com. Or they can go to this PitchSmart website, which is pitchsmart.org.
Okay, and it's up on your screen right there. So if you would like to learn more about, obviously, baseball injuries or any kind of sports training, this is the doctor to teach you. Thank you so much for being here.
Thank you.